Nurses who practice in the setting utilizing ABCs should continue to implement the 3 checks to avoid administering the wrong drugs: drug retrieval, drug preparation, and administration. A common preventable medication error is interchanging look alike, sound alike medication pairs. To reduce the risk of errors, all clinical staff must know the hospital's list of look-alike, sound-alike drugs and its importance to patient safety. The ISMP and the Food and Drug Administration are also suggest the use of tall man lettering to differentiate drugs with look-alike names. The name is highlighted by uppercase letters, colors, bolding, and italics to call attention to the similarity between look-alike drugs and names. Patient Safety Goal 3, post online an extensive list of LS look-alike, sound-alike medications that pose the greatest risk for medication errors. The Joint Commission 2011 National Patient Safety Goal 8 addresses the practice of reconciling the right medications across the continuum of care, beginning with administration, transferring with the healthcare facility and back home or to a long-term care facility. Goal 8 includes complete list of current medications taken at home. The medication order are compared to the list and discrepancies reconciled and documented. Upon discharge or transfer to up-to-date reconciled medication list is communicated and documented. These standards will prevent many medication errors of transcripts, omissions, duplications, and drug interactions. Right amount. Errors involving the administration of an incorrect dose of medications result from illegal prescribers' handwriting, transcription errors, miscalculation of the drugs, misreading of the labels. To eliminate errors, two nurses must check some potent high alert drugs, consult drug references to confirm the dose of medication. The officials do not use lists will also help eliminate dose problems for medication orders daily. Every other day or measured in units. Increased caution must be taken when administering medication to children due to weight-based drug calculations, fractional doses, and the need for decimal points and calculations.
Calculating, preparing, and administering the wrong dose of drug are preventable medication errors. Full attention to accurate dosage calculations will ensure that you avoid such liabilities. Right route. Errors involving the route of medication administered can occur for several reasons. Illegible prescribers' handwriting, nurses' knowledge of medication and their dosage forms, administering multiple medications that are incompatible, preparing the medication improperly, using improper administration techniques, be alert to the need to change or clarify administration forms or routes for the patient receiving medication through a feeding tube. Right time. Medication orders should include the frequency with which a drug is to be administered or the specific administration schedule. The Joint Commission has taken steps to prevent common errors in regard to the time a drug is to be administered by prohibiting the use of some abbreviations related to dosing frequency. Right documentation. The last step in medication administration, factors that contribute to medication errors are fidget, fatigue, lack of time. Nurses who prioritize their time may give medications correctly but fail to document that they have done so. This omission can result in unintentional over-medication of the patient by the follow-on nurse. The nurse's critical role in medication error prevention. The most common ways to reduce errors between patients and errors healthcare providers is open communication between the medication and encourage patient questions. The Joint Commission Speak Up program tips for patients to reduce medication errors. Medication Errors Reporting Program, MERP, a confidential national voluntary reporting program. Whenever a medication error is identified, the nurse must follow the health organization procedures for reporting. This enables organizations to track errors and implement improvement processes aimed at preventing repeated errors. Combating errors requires diligent adherence to safety standards. Stay alert by practicing the 6 rights of safe medication administration. Regularly read prevention publications, spotting and reporting medication errors. Summary. Medication administration is a critical nursing skill that can lead to costly errors and morbidity and death if not carried out correctly. The nurse is responsible for making sure that the right patient receives the right drug in the right amount, by the right route, at the right time, with the right documentation. The nurse who administers a medication is liable for medication errors even if the primary cause was an unsafe order, incorrect transcript, or wrong drug, incorrect dosage calculations, improper preparation, or administration errors.